Ashley. I'm a nurse practitioner. And you are Mr. Turner?
Yes.
Okay. Is it okay if I call you that?
Yes.
Okay. So how are you feeling today?
Good. Good.
That's wonderful. So today we're going to be conducting a health history on you. So I'll ask you a bunch of different questions. Please feel free to share as much or as little information as you would like. But first I'm going to ask you a couple questions and you just verify them for me. So your full name is Christian Julius Edward Turner.
Yes.
You are 24 years old.
Yes.
African American.
Yes.
Single.
Yes.
And identify as a male.
Yes.
Okay. So what brings you in today?
I'm just looking for just to get set up with a new primary care provider and just to have an annual physical.
Okay, we can definitely get that done for you today. So I'm going to start by asking you the questions. Can you tell me a little bit about your past medical history? Any history of hospitalizations, illnesses, surgeries?
No, I haven't really had any, anything historically at a hospital or anything wrong, so I think it's a pretty clear one.
Okay, ever have like any wisdom teeth taken out, anything like that?
No wisdom
Nothing?
teeth taken out.
Okay. So you've never been diagnosed with any sort of medical, like disease or illness?
No disease, no illness, no.
Okay, do you take any prescription medications or over-the-counter?
No prescriptions, no over-the-counters.
What about supplements, herbal remedies?
I take fish oil,
Okay.
magnesium, and I forgot the other one.
Did you
But
consult with someone before you decided to start taking those, or did you just do that on your own?
No, I just did it on my own.
Okay. Do you have any allergies?
No allergies.
No allergies, none at all. And nothing to medications, environmental agents?
Mm-hmm.
No? Okay. Do you know if you're up to date on your vaccinations?
I had my last COVID shot probably last year, so I'm not too sure, but I think I am.
Okay. Do you have your vaccination records with you?
Yes.
Okay. So after we're done, we can get that scanned into our system. Okay.
Okay.
Okay. So can you tell me a little bit more about your family?
I have one brother and a sister, and my mother and my father. Health-wise, I don't think we have anything glaring or anything that needs to be.
Not that your parents have shared with you. They don't have any medical history that you know of.
I think one of them has a little bit of a high blood pressure right now, and
Okay.
they may be taking some medicine to try to get that down. But I think other than that, I think that's it.
What about do you have grandparents?
None of them are still alive,
Okay.
but
Do you know if they had any medical diagnoses?
I know my grandmother had dementia, and what's the high blood pressure thing called?
Hypertension?
Yeah, no, or it was diabetes.
Oh, diabetes, high blood sugar.
High blood sugar.
Okay.
Yeah.
So you said one of your grandparents had diabetes? Okay. All right, and nothing with your sister or brother, as you mentioned?
No.
No? Okay. So how about you tell me a little bit more about yourself, like your education, current state of employment?
Yeah. So education-wise, I completed my master's degree. So I currently work at Centos. I'm a sales rep there.
Okay.
And I live in Cleveland. I live with my girlfriend.
Mm-hmm.
We have a place together, and I'm very happy.
Okay. Do you feel safe where you live?
Yeah.
Yeah. Okay. Do you have a strong support system?
Yes.
Yeah. Okay. Do you use tobacco or vaping products?
No.
Do you consume alcohol?
Yes.
Yes. How often? Or how many drinks a week?
Per week? Maybe on average one
Maybe.
or two, but there's some weeks I don't drink, and then there's some weeks I do.
Okay. Do you use any illicit drugs?
No.
No. Ever use any in the past?
Yes, I smoked some weed.
Oh,
but
okay.
That's it.
Can you tell me a little bit more about that? When that took place? Do you still do it?
No, I've only done it a handful of times, but
Okay.
nothing too crazy.
Okay. Are you sexually active?
Yes.
With male or female partners?
Female.
And do you use protection?
No.
Okay. What type of activities do you like to do in your free time? What brings you the most joy?
I like working out. I like being active. I like playing sports, pickleball. I like cutting hair. I like anything that's just getting me up and moving.
Okay, so sounds like you're a pretty active guy. So
Mhm.
do you exercise regularly?
Yes, I do.
Like how long? How long? How many times a
Probably
week?
an hour and 10 on average, 6 days a week.
Okay, wow, that's a lot. It's very good. Do you follow a certain diet or no restrictions, or do you restrict yourself?
I mean, I try to eat pretty healthy. I don't neglect anything, or I'm not a vegetarian or anything like that. But
Okay.
I try to eat pretty healthy.
Okay. Do you have access to healthy food options nearby?
Yes.
Yeah. Okay. And in general, how do you feel about your current state of health?
I think I'm pretty healthy.
Pretty healthy?
Yeah, young and healthy.
Okay. All right. So I'm gonna move into the next part of the questions.
Okay.
So these are more yes or no questions, but please feel free to elaborate. Are you experiencing any pain, fever, chills, malaise, or fatigue?
No.
No. Any vision changes such as blurring, seeing double?
No.
Do you follow with an optometrist, an eye doctor?
No.
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 Nope. Okay. Any change in your hearing? Any like hearing loss? Do you get ringing in your ears, pain?
No.
Ever have an ear infection before?
No. Oh, yeah. I actually did have an ear infection once.
Once?
Yeah.
When?
When I was in college.
In college?
Yeah,
Okay.
an ear infection.
And then what happened with that?
They prescribed me with some antibiotics,
Okay.
and I took those, and it was gone.
Okay, very good. Any difficulty breathing through your nose or a change in your sense of smell?
No.
Ever have a bloody nose? Do you get pain or drainage in that area?
No.
No? Okay. How often do you get sore throats?
Never.
Never. Ever experienced any bleeding or swollen gums?
No.
And ever have any teeth extracted? I know you said you didn't have your wisdom teeth taken out, but anything else?
No.
No? Okay. Do you get sores or ulcers in your mouth or tongue, around your tongue?
No. Nothing other than when I bite my lip too hard.
Okay. Do you see a dentist?
I haven't in a little while. I used to on a regular basis, but I haven't been for the past few years.
Okay. Any tenderness or enlarged lymph nodes?
No.
How about any chest pain, shortness of breath, wheezing, cough?
No.
No. Any abnormal colored sputum, which is like stuff you spit up?
No.
No. Okay. Have you ever had a chest X-ray done before?
No.
Okay. Ever been diagnosed with COPD, obstructive sleep apnea, emphysema, asthma?
No.
Okay. And you already said no to smoking or using tobacco products?
No, yeah, I don't.
Don't use any of those? Okay. Do you have any chest pain, palpitations?
No.
Have you noticed any increase in swelling in your arms or in your legs?
No.
Do you have difficulty laying flat?
No.
Have you ever been diagnosed with hypertension, coronary artery disease, hyperlipidemia, CHF, heart attack, cabbage?
No.
Okay. Have you ever had any cardiac testing done, such as EKG, an echocardiogram, or a stress test?
No.
Okay. Any changes in your appetite recently?
No.
Do you experience indigestion, heartburn, nausea, vomiting, or difficulty swallowing?
No.
Okay. Do you have any abdominal pain?
No.
Constipation or diarrhea?
No.
Do you have bowel movements regularly?
Yes.
Ever have any gallstones, hemorrhoids, ulcers, polyps, or tumors?
No.
Any recent unexplained weight loss?
No.
Any heat or cold intolerances?
No.
So I know you said one of your grandparents was diagnosed with diabetes. Have you ever gotten a hemoglobin A1C drawn before, which is a good lab to draw to indicate pre-diabetes, diabetes?
No.
Not that you know of?
No.
Okay. Any difficulty with urination?
No.
Do you have urgency, frequency, blood in your urine, discoloration, dribbling?
No.
Okay. Ever have a sexually transmitted infection?
No.
Okay. Have you had any changes in the pigmentation or texture of your skin?
No.
Do you get rashes or itching?
No.
Okay. Do you have any abnormal hair or nail growth?
No.
No. I see you have this scar on your arm.
Yeah.
What's that from?
Well, I got cut, and this is the way my skin healed up.
Okay. Must have been a pretty bad cut.
It wasn't really bad. It didn't go very deep.
Did you seek any medical attention for that?
No.
No.
I did not.
Okay. Do you see a dermatologist?
No.
No. Okay. Have you ever seen one before?
Yeah. When I was younger.
Okay. Tell me a little bit more about that.
I was experiencing some acne.
Okay.
And me and my parents figured go get checked out and see, if there was something we could do. And I was prescribed some salves and some pills back when I was younger, but I haven't taken those in years.
How do you feel about your skin now?
I think it's cleared up.
Okay.
I think it's really good.
Very good. Any numbness, tingling, joint stiffness, pain, or weakness?
No.
And have you ever broken any bones?
My collarbone,
Which one?
my left one.
How'd that happen?
Well, when I was younger, I got launched in the air and fell on my shoulder and broke it.
About how old were you when that happened?
10 or 11.
Oh, wow. Okay. Did you have to wear a cast or like a
A
sling?
sling, yeah.
For a while?
Yeah.
And it's healed over okay?
Yeah.
Any pain there?
No.
No, okay. Have you ever had any episodes of dizziness or syncope?
No.
Okay. Have you ever had a head injury such as a concussion or a traumatic brain injury?
No.
Okay. Do you get headaches?
No.
Okay. Have you ever had a seizure? Do you get tremors or a stroke?
No.
Okay. Any abnormal bruising or bleeding?
No.
Have you ever taken any anticoagulation before? Which
No.
is a medication that thins your blood?
No.
No? Okay. Have you ever received a blood transfusion?
No.
Ever have a history of blood clots like a PE or a DVT?
No.
Okay. Ever been diagnosed with anemia or sickle cell disease?
No.
No. Okay. Any recent mood changes?
No.
Increased in agitation or lethargy?
No.
Have you ever been diagnosed with anxiety or depression?
No.
Any thoughts of suicide?
No.
Any changes in your sleep pattern? Do you have difficulty falling asleep or trouble staying asleep? Do you get night sweats?
Sometimes night sweats, and sometimes I wake up out of my sleep.
Okay. What do you think contributes to that?
I don't know.
Have you ever sought help for that, or
No.
have you told anyone this information before?
Just my girlfriend.
Okay. So what do you mean? You just wake up in the middle of the night? Are you
Yeah.
sweating when you wake up, or having a nightmare?
I do sweat, and I do have vivid nightmares
Okay.
decently on a decent basis regularly.
Okay. It's a little concerning.
Yeah.
We can talk more about that at another time. Okay.
Okay.
All right. Is there anything else you think it would be important for me to know?
No.
No? Okay. Well, thank you for your time, Mr. Turner, and you have a great day.
Thank you. You too.